Hello, I'm Melanie the Midwife, and today I'm going to be talking about trauma and childbirth. I'm not talking about physical trauma that can be seen. I'm going to talk about a growing field of research into emotional birth trauma, but more specifically, the emotional and psychological trauma that women feel as a result of how they were treated by their care providers. The paper we're going to look at today is called Women's Descriptions of Childbirth Trauma Relating to Care Provider Actions and Interactions by Rachel Reed and her crew. Today's research is a result of a mixed method study design, which means that the researchers combined elements of qualitative and quantitative research designs in order to gather and analyse their data. The authors used an online survey and face-to-face interviews for this paper and have drawn on survey results from 748 women from around the world. This study delves into and seeks to learn from women's actual experiences with their care providers during childbirth. More specifically, the data used for this study was drawn from women's responses to the survey question: describe the birth trauma you experienced and what you found traumatizing. Prior to completing the survey, the women had already self-identified that they had experienced birth trauma and so went on to participate in the research. Of the 748 women who described what they found traumatizing about births, a third described events such as premature labour, hemorrhage, or concerns regarding their baby's well-being. However, the majority, 66.7%, described care provider actions and interactions as the traumatic element in their experience. There were 4 overarching themes that were identified. Number 1, prioritising the care provider's agenda, where women described how care providers prioritise their own agenda over the needs of the woman. This article presented multiple quotes from women that they used to highlight their point. One woman explained that her obstetrician came in and told her she would like her to deliver by 5 p.m. because she wanted to go home. Another woman explains that in her circumstance, 20 people were in the theatre and they were sitting down on their phones and chatting away while someone who was training was doing forceps on her. Number 2, disregarding embodied knowledge. Many of the descriptions involve women's knowledge being disregarded in favour of the care provider's assessment of events. One woman explained her fears for her baby's safety. She said, "My baby was in distress and I had meconium liquor, and in all honesty, I probably should have had a cesarean section. At this stage, I was begging for one and I knew something was wrong with my baby, but they refused." In this description, the woman's own assessment of her baby's well-being was not valued or acted on, and this caused her trauma. Number 3, lies and threats. Women perceived that they were being lied to by their care providers to coerce them into agreeing to unnecessary interventions. One woman explained, "It was not the birth itself that I found traumatic, rather the way we were treated by the midwife. Being lied to in order to speed up my labour unnecessarily and putting me and my baby at risk." The woman also described how care providers threatened them in order to coerce them into undergoing procedures. One woman explained, "My daughter was breech and I was told that if I didn't consent to a cesarean before labour, then they would perform a cesarean without my consent under general anaesthesia when I arrived." Another woman described being threatened with having her baby taken from her if she did not comply with proposed interventions. She said, "If you do not consent to syntocinon or a cesarean section, then we will get our friend the psych registrar down here to section you, and then we can do whatever we want to you, but you may not be able to keep your baby. All I wanted was to let my body go into labour naturally and my baby was not in distress." Number 3, violation. Many women describe their birth experience as violating. A lack of control appeared to be associated with a sense of violation. In this section, the care providers carried out actions against the explicit wishes of the woman. One woman described how her obstetrician assaulted her in order to gain her compliance to induce labour. She said she wanted to do one more cervical check. I consented. And when she did it, she grabbed my cervix and pinched it. She would not let go until I consented, to letting her break my water. I was in tears from the pain, screaming, begging and sobbing for her to let go and get her hand out of my vagina. She would not let go until I consented, which I finally did. In describing their experiences, women used words such as humiliating, belittling, brutal, and barbaric. Women likened the treatment they received to rape and sexual violence, and one woman explained, "The most terrifying part of the whole ordeal was being held down by 4 people and my genitals being touched and probed repeatedly without permission and no say in the matter. This is called rape, except when you're giving birth. My daughter's birth was more sexually traumatizing than the childhood abuse I'd experienced." This study described women's experience of birth trauma. The data set was large, and women recounted similar experiences across different birth settings and cultural contexts. The findings contribute to an understanding of birth trauma from the perspective of the women experiencing it. And I know some of you are thinking that there's no way these things are happening in Australian or Western hospitals. I can tell you that from my research, this is just what the women were talking about. This is happening in Australian hospitals under the care of Australian care providers. These findings are consistent with other studies that identify the relationship between the care provider and the woman as critical to the birth experience. Whilst care providers may consider their actions and interactions to be routine, some women experience them as traumatic. Therefore, it's vital that care providers understand how their practice influences a woman's psychological and emotional experience of birth. In particular, maternity care providers should know that consent is an important legal and ethical principle in healthcare. For consent to be valid, it must be voluntarily and freely given. The person consenting must not be under any undue influence or coercion, and there must be no misrepresentation as to the nature or necessity of the procedure. Whilst the mistreatment of women in labour occurs at the level of care providers, it is influenced by the systematic failure of the healthcare system in general. Current healthcare systems are underpinned by technocratic biomedical paradigms in which the patient is considered passive and authority and responsibility are inherent to the practitioner. The power dynamics operating within this paradigm contribute to the legitimizing the control that care providers have over women and subsequently to their mistreatment. What this and the growing body of evidence around trauma as a result of childbirth is showing is that the maternity care system is failing to meet the emotional and psychological needs of women in labour, and that women are being treated poorly in childbirth. Let's just start by acknowledging that we haven't gotten mainstream maternity care right, and then go from there to start making improvements. Let's start by respecting the wishes of women, regardless of what the outcome might be. I'm Melanie the Midwife, and if you found this helpful, pass it on.